Welcome to Metalactor. Today we are going to discuss different attachment of muscles and the ligaments to the radius bone. So let's start. First of all, we will revise the borders and the surfaces of the radius bone, which we have discussed in the previous lecture. So if we see the transverse section of the radius, then here you will see the three borders. Here you can see this is the medial border, and this is the anterior border, and this is the posterior border. Basically these are the three borders of the radius. And if we see the surfaces, then you see that this is the anterior surface, that is between the medial and the anterior border, and here is the posterior surface, that is between the medial and the posterior border, and last is the lateral surface. This is actually present between the anterior and the posterior border of the radius. So these are basically the three borders and the three surfaces. We actually divide the radius into three parts: upper portion, shaft region, and the lower portion. So first of all, we will discuss what different muscles and the ligaments actually attach to the upper part of the radius. So most important component that is present at the upper part of the radius is the radial tuberosity. So here you can see first component is the radial tuberosity. This is the component. Here you can see this one. This is actually the radial tuberosity. This is the anterior view and this is from the posterior side. And you see that radial tuberosity has two surfaces. This is the anterior side, and at the posterior side. So at the anterior and the posterior side of the radial tuberosity, you will see a muscle attachment that is called brachioradii. Brachioradii is actually attached to the anterior and posterior aspects of the radial tuberosity. And at the anterior side, you see an important component which is called the bursa. So actually at the anterior side, you will see the bursa is actually present. Bursa is actually a thin sac-like structure having fluid, and that is involved in the reduction in the friction. So actually at the anterior side, you will see the bursa. So this is the two aspects of the radial tuberosity. Next, at the neck region of the radius, here is actually the neck region. At the neck region, you will see the ligament which is called the quadrate ligament. Quadrate ligament is actually present at the neck region. So here you can see this ligament. This is the attachment side of the quadrate ligament. So that is above the radial tuberosity, and below the radial tuberosity you will see at the below radial tuberosity you will see a cord which is called the radial cord. Radial cord. So actually radial cord is present below the radial tuberosity. This is the attachment side for the radial cord. So now these are the three major attachment at the upper side of the radius bone. Next we will see at the shaft region. Middle region is the shaft region, and in that situation we divide into three. First we see the lateral aspect, second is the anterior aspect, and last is the posterior aspect. So these are basically the three aspects. You see only the lateral surface. There is no lateral border. At the lateral surface, we see, or we divide it into three components. So first is the upper lateral surface. This is actually the surface. Second is the middle lateral surface, and last is the lower lateral surface. Now what muscles are actually present at the upper, middle and the lower part of the lateral surface? So we can remember it by, if we say just for the fun, that the Spider-Man and the Batman have strong muscles at the lateral surface. So this point is very much important. SP stand for Spider-Man and B for Batman. So if we see at the upper part of the lateral surface, we see the supinator muscle. So in that situation, you will see the supinator muscles. So here you can see like this one. At the lateral surface, you will see this muscle is actually the supinator muscles. Okay, and that is actually present at the upper part of the lateral surface. At the middle part, you will see P. P stand for pronator teres. So here is the situation in which you will see pronator teres muscle. So in that situation, at the middle side, you will see the pronator teres muscle. This is the anterior side and this is the posterior side, pronator teres muscle, or you can say this is actually the supinator muscle. So at both sides, at the anterior and the posterior side, you will see at the upper portion supinator muscle, at the middle portion you will see the pronator teres muscle. So and at the lower portion you will see, here is the situation, at the lower portion you will see the Brachioradialis muscle. So at the lower portion of the lateral surface, you will see the Brachioradialis muscle is actually present at the lower side of the lateral surface. So this is all about the lateral surface. Next we see the anterior aspect. So we see the two, anterior surface and the anterior border. So here you can see this is the anterior border and the anterior surface. Now first of all, we will see what muscle is actually present at the anterior border. So if we see here at the anterior border, this is the anterior border. Now at the anterior border, or if I say specifically that the anterior oblique line. So actually there is a line which is actually present at the anterior which actually attached to the anterior border, and that is actually line is actually called the anterior oblique line. So what muscle is actually present at this point? You will see the Flexor Digitorum Superficialis muscle. So you see here at that side you will see the Flexor Digitorum Superficialis muscle. So this point is very much important, and this muscle is actually here. This one. This is the Flexor Digitorum Superficialis muscle is actually present at the anterior oblique line. So this is actually the anterior border. And next is the anterior surface. We divide anterior surface into the upper portion and the lower portion. So if we see here that at the upper part and at the lower part. So here you can see this is actually all the anterior surface. Now this anterior surface has at the upper side and at the lower side. At the upper side you will see this one. This one you will see the attachment of the muscle which is called the Flexor Pollicis longus muscle. This is actually the upper aspect of the anterior surface. And here next is at the lower aspect you will see the Pronator Quadratus. So here are basically the two muscles. At the upper aspect you will see here, at the upper aspect you will see the Flexor Pollicis longus muscle. This is actually present at the upper aspect of the anterior surface. And at the lower side, you will see the pronator quadratus muscle. Now, this pronator quadratus muscle is very much important. Actually, the radial artery is actually pass over the pronator quadratus muscle. So in that situation, we can easily palpate the radial artery. Next is the posterior surface. So this is the posterior surface. So here you can see, this is at the posterior surface. You will see two important attachment. So here is the situation. At that situation, first attachment is the abductor pollicis longus muscle, and second is the extensor pollicis brevis muscle. So two muscles you will see, abductor pollicis longus muscle. So this is actually the first attachment at the posterior surface. Okay. Second is the extensor pollicis brevis muscle is actually attached to the posterior surface. So this is actually the shaft region, how different muscles attach to the different borders and the surfaces of the shaft region. And last is the lower portion, in which you will see the different tendons are actually passed through the lower portion of the radius. So as we have discussed the different grooves of the radius. So in that system, you will see the first groove that is actually present at the anterior border and between the styloid process. Anterior border and the styloid process, you will see the first groove. Second groove is actually present between the styloid process, and here is the dorsal tubercle of Lister. And this is the third groove is actually called the oblique groove, and this is the fourth groove. Four grooves are actually present to the radius. Fifth groove is actually present between the radius and the ulna, and the sixth groove is specific to the ulna bone. So if we see the transverse section, so here you can see this is the radius bone and this is the ulna bone, and in that system you will see this is the first compartment, or you can say groove. This is for the second, third, fourth and fifth is between radius and ulna, and sixth is specific to the ulna. Okay. Now, if we discuss the first groove, or you can say first compartment. So this is the first compartment. In the first compartment, you will see the two tendons are actually passed through the first compartment. Okay. Now, in this case, you will see the PLB. Okay. In that case, you will see first is the abductor pollicis longus tendon. Actually, abductor pollicis longus muscle has tendon at the last. As we know that the muscle attached to the bone with the help of the tendon. So in this case, you will see the abductor pollicis longus tendon, and second is the extensor pollicis brevis tendon. So these are basically the two tendons. Now this is the first compartment. Here you can see these are basically the two things, and you can remember it by the PLB, pollicis longus, pollicis brevis. Okay. Second, you will see the second compartment actually contain two tendons. So you can remember it by the CRLB. In this case, you will see the extensor Carpi radialis longus muscle, longus tendon. Okay. Now, and also see extensor Carpi Radialis, Brevis tendon. So again you see the two tendons, and here you can see this one, and you can remember it by this CRLB, Carpi Radialis Longus, Carpi Radialis Brevis. Okay, now the third one is the, here is the third compartment is actually for the PL. In this case you will see the extensor Pollicis longus tendon actually pass here. This is the PL, Pollicis longus. Now you see that this is the extensor Pollicis longus and this is the abductor Pollicis longus muscle. So keep remember, at the first compartment you will see the abductor Pollicis longus tendon, but at the third you will see the extensor Pollicis longus tendon. Okay. Now fourth is very much important, fourth compartment. In the fourth compartment you will see two things. You can remember it by the ID. So in that case you will see the extensor indicis and extensor digitorum. Okay. Now the important thing is that here, if you see here, like this is actually the extensor digitorum. Extensor digitorum at the last point divides or give rise different tendons. So here you can see from the extensor digitorum muscle, you if I say 4 tendons arise from the extensor digitorum. So in that case you will see, if we cut this hand and see the transverse section, so here you can see, you will see the 4 tendons. So these are basically the 4 tendons of the extensor digitorum, and one is for the, this is the extensor indicis. So this compartment, fourth compartment, has 2 extensor indicis and extensor digitorum, but there is 1 tendon for the extensor indicis and 4 for the extensor digitorum tendon. Okay, and fifth is the, here is the fifth compartment. In that case you will see the, by, you can remember it by the MD. So in that case you will see the extensor Digiti Minimi tendon. So you will see at the fifth compartment you will see the extensor Digiti Minimi muscle has tendon. So in that case you will see this is the MD, Digiti Minimi tendon, actually present in the fifth compartment. And last is the sixth compartment. Sixth compartment has the, you can remember it by the UC. So in that case you will see the extensor Carpi Ulnaris tendon. So at the last part you will see this one. You will see, remember UC. Carpi Ulnaris tendon is actually related to the ulna. So these are basically the sixth compartment, and sixth compartment has the different tendons lie in that case. So this is the lower portion. This is all about the radius bone. If you have any question then you may ask in the comment section. Thank you so much.